Good evening, friends. This time for the session of Conceptual Connect, we are going to discuss on the prolapsed intervertebral disc or the slip disc or the disc herniation. Now, this is one of the most common topics that is there in your exam. Also, whenever the topic is very common, there are a lot of questions that are asked in depth of this, and hence we get a phobia and fear with respect to that. Because as it goes without saying, the more the easy the topic, the more are the chances of you causing some mistakes in it. And generally, in such simple topics, mistakes are not something that are appreciated. So, what is basically the structure of disc? So, disc is basically the structure that is present in between the two bones. The disc contains of two different structures. One is the annulus fibrosus, which are these fibers which surround this gel-like structure, which is nucleus pulposus. Now, this annulus fibrosus is as tough as, the fibers are very tough. You can compare them to like a tire, they are that tough. And this nucleus pulposus basically gives the movement, and because of this, it is basically contained inside. It is contained inside by the annulus fibrosus. Now, these fibers of annulus, they form different layers, almost 5 to 6 different layers. And one critical thing about this is all these layers are at a different angle of around 30 degrees as in relation to each other. So with respect to this, we get a really solid, tough, taut structure that is able to contain this gel-like structure, which is under very high pressure, and hence it has the tendency of slipping and coming out. Now, when we talk about the annulus, there are three groups of fibers which are mainly there: the outer, the middle, and the inner. So the outer fibers are the fibers that basically connect the vertebral body to the undersurface of the epiphyseal ring. Middle ones are the ones that connect the epiphyseal ring above and below. And inner are the ones that connect the cartilage above to below. So over here, as you see, this is the cartilage plate. These are the epiphyseal rings. This whole structure is the disc. This is the axial plane wherein you see the nucleus pulposus, and surrounded by them are the annulus fibrosus. Now, the outer fibers are the one that connect the vertebral body to the undersurface of the epiphyseal ring. So the outer fibers are the one that connect the vertebral body to the undersurface of the epiphyseal ring. So these are basically the first fibers or the outer fibers. The middle fibers are the ones that connect the epiphyseal ring above to below. So these fibers that connect the one epiphyseal ring to the other, these are the middle fibers. And the inner fibers are the ones that connect the cartilage proximally to the cartilage distally. So these are the ones which are in close association with the nucleus pulposus. This the innermost fibers, which basically connect the cartilage proximally to distally. And as you see, beyond the outer fibers is the anterior longitudinal ligament on one side and the posterior longitudinal ligament on the other. What is a hoops and barrel concept? So basically, you have to imagine the nucleus pulposus to be under very high pressure, and it is contained via a barrel. The tendency of the water inside is to, until unless everything is fine, the water is inside and the barrel is also completely intact. If because of some reason there is an excessive pressure on the water, the barrels may start to give away like this, and there may be slippage of water that may happen. Now this generally may happen because of two reasons. One, if ever there is a pressure on the water that is exerted, or because of any reason this pressure within the barrel increases. Number two, if the barrel over here starts to give away, there are some cracks that come in, so that will also cause this content of the barrel, that is the water, to come out under very high pressure if there are some cracks inside this barrel. So this is the hoops and the barrel concept, wherein the disc is basically the structure which is present inside. It is contained very well via all these structures which keep it together, that very taut and hard fibers, that is the annulus. If because of some reason the pressures increase, or if because of any reason there is some tear that happens within the annulus, so that is when this may start to come out. So when we talk about the molecular anatomy, what is the differentiation between the two? The nucleus pulposus and the annulus fibrosus. So nucleus pulposus basically contains proteoglycans, so does annulus. Both of them contain water. Nucleus contains high amount of type 2 collagen. As against this, the annulus fibrosus contains more of type 1 collagen. So the nucleus contains the type 2 collagen and the annulus contains the type 1 collagen. Also, the collagen is to proteoglycan ratio is low in nucleus pulposus, and the collagen is to proteoglycan ratio is very high in the annulus. So maybe this is a reason why, that is with the type 1 collagen and higher of collagen is to proteoglycan ratio, the annulus is tough taut as compared to nucleus pulposus, wherein type 2 collagen and lower collagen to proteoglycan ratio may make it, gel like, free flowing as compared to the annulus. So now Kirkaldy-Willis cascade was a cascade that was given that basically told us regarding the stages of the disc degeneration. So they gave three different stages. The first phase is dysfunction, the second phase is instability, and the third phase is the restabilization. So, whenever we talk about anything that happens at the molecular level in the disc in regards to the degeneration, so what we always talk about is the wear and tear. What is it basically? The anabolism and the catabolism. There is a ratio or the balance which should be properly there between the synthesis of some substances and the catabolism. If the catabolism is way higher and the synthesis is not there, that will create an imbalance. So now the stage 1 dysfunction is basically the first stage wherein because of some reason there is a dysfunction that happens at the disc level. So when the disc is not able to function properly, the cushion effect is not there. It is not able to do the actual work that it is supposed to do, which a normal disc should. Why? Because of some dehydration, because of some wear and tear, because of some degeneration. Now, this first step of dysfunction is followed by some instability that is created. Now, whenever this disc is not able to function properly, there may be excessive amount of stress on the vertebrae above and below, which may also have some abnormal movement between the two, and they may not be moving very much normally in regards to each other. So, whenever there is a dysfunction, after this, according to them, there is a small phase of instability wherein the facetal joints, wherein the relation of the two vertebrae with respect to each other is not normally maintained. Followed by this is the third phase or the phase of restabilization, wherein if you see over here, my friends, the disc height is completely lost. Also, the facet joints which are there, which were healthy over here, they have completely given away from over here. They are degenerated and arthrotic. There are arthritic changes in these facetal joints. Over here, you see healthy facetal joints. So dysfunction followed by instability followed by restabilization. In restabilization, however, the disc height is not there and also the facetal joints are completely arthritic.